Welcome to the AARP Community Education Program. We offer information on a variety of subjects, including Social Security, fraud, finances, caregiving, and today we are going to be talking about Medicare. Medicare consists of 4 different areas, and we will break those down for you. Let's begin with the open enrollment. The period for open enrollment began on October 15th through December 7th, and this period allows you to make certain changes to your coverage, and you should have received mailings from the organization about changes or improvements to Medicare, and all people should have received a Medicare and You handbook for 2022. Now, if you're happy with the plan you have, you don't have to do anything. And there's also help within the community, and we will talk to that a little more detailed during this presentation. As I said, we're going to share information on both original Medicare and Medicare Advantage. We'll be talking about who qualifies, the options that are available, and then we will make a more detailed 7-point comparison. Now, who qualifies for Medicare? You must be 65 or older and have accumulated 40 credits of employment history. Also, those covered by Social Security disability for more than 2 years, regardless of their age, and anyone with end-stage renal failure. Now we're going to be comparing original Medicare, which consists of Part A, hospital insurance, and this is automatic. The same is true of Medicare Advantage. Hospital insurance, Part A, is included. Now with Part B, with original Medicare, this is optional. This covers medical insurance. The thing to remember is if you choose not to use this initially, if you change your mind later on, there is a penalty for a late sign-up, which will persist for the rest of your life. With Medicare Advantage, medical insurance is included. Back to original Medicare, Part D includes prescription drugs. And once again, Part D is optional. However, if you change your mind later on, you will be subject to a penalty. Part D with Medicare Advantage is included. Original Medicare is basically fee for service with any provider who accepts Medicare. Whereas Medicare Advantage is managed care, either health management organization or a preferred provider organization. And by managed care, it means you have a primary physician who will manage how your care is delivered. With original Medicare, you have a choice of providers as long as they accept Medicare. And with Advantage, you will choose from network doctors and hospitals. So there are definitely limitations since doctors are not in every network, nor are hospitals. A specialist referral may be required, although that is changing with 2022. With original Medicare, there is no out-of-pocket limit to what your costs might be. And with Medicare Advantage, there is a specific out-of-pocket limit, which is identified by each individual plan. With original, Part B is purchased, whereas with Medicare Advantage, Part B is included. Part B with original Medicare has a 20% coinsurance as compared to Medicare Advantage, where Part B has copayments that are typically less than coinsurance. With original Medicare, Part D medications is purchased, and with Advantage, Part D is included in virtually all cases. Now, here's a big difference in some people's minds. Original Medicare can be augmented with Medigap, which may be known as a supplemental policy to cover most, if not all, of the various costs that you might incur. Medicare Advantage cannot be combined with a Medigap policy. This is a significant consideration for many people. And Medicare Advantage may have some additional premiums, but that depends on the plan. The resources that are available to you are the State Health Insurance Assistance Program, SHIP, using this link on the screen or a phone number if you want to speak to someone. The Area Agencies on Aging, Region 1, is an excellent unbiased source of information for seniors. You can go directly to the Medicare website or call them. In Arizona, the Access website will provide additional information, especially for those people who are looking for extra help. And finally, we have the AARP website relative to Medicare that can answer some questions you might have. Thank you very much for joining us today, and I hope you've learned something and will continue to participate in our education program. Goodbye.